Thank you to each of our witnesses and those who have joined us for this very, very important discussion. During the COVID-19 pandemic, we witnessed firsthand how essential the social fabric of our communities is to crime prevention and keeping us all safe. People lost jobs, fell out of routines. Some lost contact with their mentors, colleagues, and their classmates. And many fell into isolation and even desperation. And crime took hold. As the pandemic continued, gun violence soared. In 2020, the final year of the first Trump administration, the United States experienced the largest single-year increase in homicides in modern history. But we didn't give up. In 2021, we passed the American Rescue Plan Act, which included $350 billion in flexible aid to state and local governments, including $15 billion dedicated to public safety and violence prevention. The following year, we passed the Bipartisan Safer Communities Act, the first major gun violence prevention legislation in decades, which included provisions to keep guns out of the hands of criminals and made additional investments in public safety. State and local leaders used this funding to implement evidence-based approaches to combat crime. They established community violence prevention programs, created real-time crime centers, hired crisis responders, and more. Beginning in 2022, these Democratic-led investments and the opportunities they unlocked for state and local leaders started to pay dividends and actually save lives. For 4 consecutive years, beginning well before the second Trump administration began, fewer and fewer people have been killed from gun violence. Murders are down nationwide, and many cities are recording the fewest murders since the 1960s or even earlier. But still, there have been setbacks. Last year, the Trump administration abruptly terminated more than 300 public safety grants across at least 37 states. In Atlanta, the Offender Alumni Association had been preventing crime through youth mentoring, hospital-based violence intervention, and reentry assistance, but was forced to shut down after losing $1.5 million in federal funds due to the Trump administration's cuts. Since then, there have been 4 deaths that, according to a former Offender Alumni Association worker, could have been prevented by the organization's interventions. The reality is that crime prevention works. And that's why Democrats from Congress, my colleagues here with me today, to governors' offices, to city councils, have long supported collaborative, evidence-based approaches to combat crime. Recently, it seems that even the Trump administration has realized that their cuts were a mistake. Just 2 days ago, the administration announced a new initiative that will fund citywide public safety efforts, much like those Democrats have long championed, but for only 2 to 4 cities and with many strings attached. Compared to the investments and local efforts that contributed to the historic drop in crime, this is a drop in the bucket. As a mother who lost her only son to gun violence, this is simply not enough. Today is National Gun Violence Awareness Day, a day that we remember the lives we have lost to gun violence, including my own son, Jordan. It has been nearly 14 years since my son Jordan was senselessly killed, and there's nothing I would ever do or ever give to have him back here today. It is impossible to identify all of the lives that have been saved by gun violence prevention. The people who are still here with their families, still attending graduations, still getting walked down the aisle, still taking their kids to their first baseball game, because someone intervened before a shot was fired. We don't know who among us escaped a fate like my son's or mine. We only know the immense weight of this work when it is gone. Today, we will hear from those who are doing that very work, making our communities safer, and using their work to honor the lives of those that we have lost. I thank each of you for being here to share with us what we can do to prevent gun violence and continue this life-saving work.